everyone just wave at the camera for me there? Awesome, thank you. All right, so hello everyone and thank you for coming. So chances are that everyone in this room has been to the doctors before. Maybe for a shot or for blood work. As many of us know, it's very rare to have a doctor actually attempt to put a needle into our skin. And that's when the nurse comes in. I want you to imagine that you've just gone to the doctor's office to get your blood drawn. The doctor steps away, and then a few minutes later approaches a timid nurse with a needle in hand. With a shy tone of voice, they say, "Hi, I'm Brad. I'm here to take your blood." Now I want you to imagine the same thing, but I want it to be a confident voice saying, "Hi, I'm Brad. How are you today? I'm here to draw your blood." Now, if I were to ask you which nurse you'd pick, the answer would be pretty obvious. Option 1, please stay away from me with a needle. I'll take option 2. This shows the importance of oral communication. Today I'll be speaking to you about oral communication in my chosen career field, nursing. I'll be informing you specifically on nursing and giving you insight of what the medical field is like, the useful and valued oral communication skills in nursing, and how the communication concepts I've learned in my speech class will help me succeed professionally. To begin, nursing and the medical field. Nursing is one of the fastest growing and most vital professions in the United States. Being one of the most detrimental roles in the medical field, it's important they do their jobs correctly. According to www.rntobsn.com, nurses provide the glue. This is because they are responsible for things such as escorting a patient into the consulting room, identifying with challenges and adhering to lifestyle changes by letting their patients know about their real life experience, allowing patients to disclose concerns not shared with doctors, being chatty, sharing a joke, and providing explanations where doctors' communication has failed. Along with all the technical skills they need to properly diagnose, treat, and comfort their patients, they must also have proper communication to build strong relationships with patients and their families. So what are these skills? Moving on to my second point, the useful and valued oral communication skills in nursing. There are 3 communication skills that apply to all general nurse scenarios. These are tone, body language, and listening. Tone being the emotions and attitudes conveyed through one's voice. This is important for nurses when it comes to patient and family communication. Sadly, there are times when a family member just doesn't make it out of the operating room. And as a nurse, you need to be able to convey those emotions properly with empathy and passion, just so you don't push anyone to somewhere where you don't want them to go. The other 2 being body language and listening also play a big part. According to www.gapmedics.com, almost 80% of communication happens through body language. Body language must correlate with what is being said so it doesn't contradict what you are speaking. With these communication skills in mind, listening must always be remembered. Partaking in so much patient interaction, a nurse must listen and react appropriately to make sure a patient feels cared for. These days, nurses are required to take classes to enhance their communication in the workplace. I'm lucky enough to take a speech class to help me with those skills. Coming to conclusion for my last point, how the communication concepts I have learned in my speech class will help me succeed professionally. Proven through numerous studies by www.cincinnatichildrens.org, communication skills training has shown to be effective at increasing nurses' ability to provide physiological support to patients. A few of these concepts are speech anxiety management, appropriate use of language, and effective email communication. Speech anxiety management applies to more than just presenting to an audience like I am now. I can also use that when writing an email. A lot of people don't really see the importance of writing an email. In our day of technology, you really need to be able to say, how is this person going to take this email? Is that how I want them to take it? Using proper language can also help my success by allowing me to discern when it's appropriate to use what words. For example, I wouldn't use medical jargon, being medical terms, when I'm talking to a patient that they're just not going to understand. Again, email communication, often underrated, the concept that it can help me succeed is effective email communication. In our modern day technology, it's used for almost everything, so it's important to use this communication properly, especially when speaking to a superior, always important. I need to consider how the message I create, again, will come across to those reading it. To conclude, oral communication in my chosen career field, nursing, is extremely important. Being overall clear and direct can help me achieve proper communication. This saves time and confusion, and in medical field, saves lives. Thank you.